Mark, say hi.
So you see yourself for YouTube. That's not true. That cannot be true. That is not true. You said it's not photogenic. Like can you believe that nobody will believe
Chief,
that?
I'll be the one to behold, don't worry. I am the beholder. This is your catchy. Okay, I am Jacob Blair Martins, Dr. NGM for short, and yeah, I help individuals navigate the challenges of medical school and share the experiences of other medical doctors as well. So yeah, you're very much welcome to my channel.
We decide, are we admitting or not? If we are admitting,
See this man, he has been tormenting me ever since. Please now. So guys, I'm in pediatric surgery. For those of you that got it correctly, I think only one person got it correctly when I checked last. I don't know about now, but yeah, I'm in pediatric surgery now. And where do I even begin? It's been a lot. It's been a lot. Like, I don't even know where to start. So actually, there is no unit A, unit B. There is just pediatric surgery here. So you're always on call. Do you get? You're always on call. You have cases for emergency surgery. You go into the theater and do the surgery. You have emergencies. You have individuals or patients to give IV medications. You go and give the IV medications. Like, it's been a lot. And funny enough, when I entered the unit was when we started having back to back cases, and I didn't even know where to begin. And I felt ill. Like, I didn't know how to cope with it. I felt ill within the course of my first week in the posting, and yeah, I was taking medications and still showing up for work and all of that, and I was super exhausted. There were days when we had like emergency surgeries, and then, you know, if you work in a Nigerian healthcare system, yeah, you get to figure out that emergencies are not really emergency. I don't know if you get me. So a patient comes with a particular condition, you need to do the blood work, you need to get investigations done, you need ultrasound scan, you need all the investigations per se that are necessary for the management of the patient here. But then you can't, okay, say maybe facilities are not ready to do the investigation, maybe financial constraints, a whole lot of factors. So a surgery that you're supposed to do, say the case appeared or the patient arrived around, say, 6 a.m. So a case you're supposed to do, say, around 6 a.m. is being done maybe later, and it can take a toll on any individual. And what the doctors do, we try to help fast track things as much as we possibly can. So investigations that could possibly delay the management of a patient, we go there ourselves, try to see how to fast track it. Because there are a lot of factors that are working against the Nigerian healthcare system. A whole lot of factors, even individual and governmental factors, a whole lot of factors. And I think maybe later on we'll get to analyze these things, maybe later on in another video. But for the sake of this, I'm in pediatric surgery, and this is my first week in pediatric surgery rotation. When I came into the unit, I met my colleague. I've worked with her previously in another unit. That's Dr. So apparently, yeah, I'm in pedo surgery now, and I don't know, I don't understand why this girl keeps following me to every unit, or why I keep following her. I don't get it, but this is catchy.
That's the order. Why
Your consultant urologist. What do you have to
is
say?
why she keeps following me. She's a baby HO where I am, so that's why she keeps following me.
cried. Don't worry. We are going to pediatrics very soon. I shall have nothing to do with you again. So this
But we'll
is
meet in
true.
pediatrics again. If you follow me to the unit, I am in pediatrics.
I just
Then I'll
know
just know
myself for
that.
life. Sure. No problem. Apparently, we're waiting for our chiefs to come. But the unit has been chilled so far. We have very beautiful wedges that tend to make life very comfortable for us so far. I can't say this.
Well, I've been in the unit longer. They do like to make life comfortable for us.
I don't think the senior reg is in on this. Maybe the reg is, but the senior reg, I hope he does not see this though. Bye. And then I met some other beautiful individual, Dr. Tengo, Dr. TG. Yeah, so double para, as we call him.
No, what do you mean by that? So, okay, let's say that you got the private jet now. If I was not wearing this kind of trouser, if I was scared, hey, Jesus Christ of Nazareth.
I don't know, for what is worth here. He's actually very chill people. And then we have two residents here in the unit. And well, what do I say? They are really very chill, literally. And one of them is particularly, I don't know what the word, but it's particularly very selfless. Juliet, very selfless. I commend him for that. And then on one of those days, he offered us cash to go get food, to go get lunch, and yeah, that was a very beautiful day. I think that was my second day in the unit, yeah, or my first. I can't really recall. Yeah, so yeah, and it was really nice. It was really beautiful. Pediatric surgery can be a lot, actually. It can be a whole lot, because you have to always be on your feet. You always have to be on your toes. You get always be available for investigations, always be available for emergencies, and you're dealing with little children. So I was complaining literally that okay, there's surgery. Was I complaining? Yeah, kind of. That surgery is very exhausting and all of that. But then this pediatric surgery rotation has given me a little hint of what pediatrics is like. Do you get? You are dealing with children and their medications, you don't just treat them like adults. So each child comes with different weights. So you have to give their medications based on the weight of the child, do you get, and the age here, and all of that. And wow. So I like surgery, yeah, I like surgery, but I don't think pediatric surgery is for, I don't know. Oh god, I don't want to say it keeps getting bad. I don't want to say it keeps getting bad, but like so far. So I'm making this video in the night actually, because I haven't had the time to get battling illness, and then work and all of that can be a lot to get. And wow, sometimes I envy the nurses. Let me just say it. Sometimes I actually envy the nurses, because okay, they have shifts. So say you come in around 6 a.m. and you're meant to be off around 12 noon. There's somebody to relieve you of duty, and when you go home, you're not bothered about whatever. You do proper handover. Do you get me? But then the doctors, even when you're off, you still need to, maybe you're being called for a particular thing, you still need to give feedback, all of that, and you're on 24 hours call, literally, the way I see it. Do you get? Even if you work maybe 12 hours, trust me, you're on 24 hours call. Just zero your mind, you're on 24 hours call. So yeah, I think it's been really, really stressful. I don't know how to emphasize that actually, but yeah, it's been something else. But then there's something I'm always grateful for, or there's something I've always known. Working with people can either make the work really terrible and exhausting, or it can make it really beautiful. So having my regis, my colleagues, okay, apparently now I'm alone in the unit, so you can imagine for the first 2 days I wasn't. For the first 3 days, I wasn't alone in the unit, but then subsequently I became the only one. So so I've always made, you have to make yourself available. Do you get me? But then the people you're working with, do you get, the regists, the consultants, your colleagues, they're the ones that really make the work a little bearable. Do you get? It is not the journey, it is the companion. So I think that's how I like to look at it, actually. So they are literally the ones that have made the work a little less stressful and a little more bearable, actually, because I don't know where I would have been. My letter to pre-medical students, all you medical aspirants, let me put it that way, that want to get into medical school proper. So the system in Nigeria may be different, where you have medical school, you have year 1, year 2, year 3, and then move on to clinicals, but generally pre-medical students. I know in most of my videos I explain how tiring and how frustrating the work can be, how it doesn't afford you enough time and all of that, do you get, and all of that. But then let me just say that I find fulfillment in what I do. Let me just put it as plain and simple as that. I find fulfillment in what I do. I find joy in what I do. Do you get? Although sometimes I ask myself, the joy you're getting or the fulfillment you're deriving from this, does it in any way overshadow or cloud the amount of stress that comes with it? Do you get? But then I just tell myself, I'm happy doing what I'm doing. Do you get? I'm happy to be here. So you might be looking at all of this and be wondering, so all the stress, everything, is it really worth it? Should I keep going? Should I take this thing serious? Should I really go into medical school and become a medical doctor? The question I want to ask you here is, why did you want to begin in the first place? So my reason was very simple. I just wanted to help people. Do you get? I was earlier in my childhood, I was in a situation per se where I saw somebody having, I think it was epilepsy, but then as at that time I didn't know what it was, and nobody knew exactly what to do. They were just trying, looking, watching. And I feel like it was at that moment or at that time where I felt I needed to be able to help individuals in that kind of health crisis, that kind of situation. So those are the things that actually shaped my mind. And I was always wondering or asking myself, in what position or in what capacity can I possibly be of the most amount of help to any individual? So that alone, growing up, and I discovered, okay, there's something called medicine and surgery, and that was how the love for medicine and surgery began. It's not like I had anybody that had been in medicine, surgery, all of that, in the health field and all of that, but it just came up. So I wanted to ask yourself, why did you choose this? Why do you want to go into medical school? Gone are the days where you say, oh, it is the most prestigious course. Well, it is. It is, if you look at it from a different point of view. But then some other people will say, okay, financial freedom and all of that. Well, those things are there, but in Nigeria, in where we find ourselves, tell yourself the truth. Is this where you want to practice? Is this the reason why you're getting into this? Because if you get into it and then you're in this environment, I don't think you derive as much fulfillment of your purpose as you would. Some people talk about Japan and all of that. So I need you to consider yourself properly, analyze your situation, and tell yourself the truth. Why am I going into this? In the long run, where do I want to see myself? Where do I want to be? What is my vision for myself? Do you get? I just need you to analyze it properly, because when you get into medical school and you're faced with a lot of challenges, you're faced with a lot of difficulties, yeah, and all of that, what would be your driving force? What would be the thing that keeps you going, literally? Do you get? I just need you to think about it, to pause and just think about it. Do you get? But in everything, yeah, in everything, medicine is it's a good place to be. Do you get? But I wouldn't advise it. Sorry, forgive me, but yeah, take your time and reason it out for yourself. This is not a decision somebody will make for you. Gone are the days when you say, oh, my mother wanted me to be a medical doctor. Fine, maybe you now found the joy or the drive in the long run. Do you get? Or maybe my father just wanted me to be a medical doctor because he's a medical doctor. What if you don't find the joy or the drive in the long run? How would you feel? Do you get? What would become of you? Do you get? I had classmates that were always like, I just want to do this med school and be done with. Do you get? I had classmates that were like that. Do you get? I also had classmates that were like very passionate about it. I also had classmates that while in medical school they were doing so many other beautiful things for themselves. And if after medical school now, or as we've graduated, maybe after house job, I'm sure they'll want to look into other beautiful things for themselves. Do you get? So yeah, and they're very beautiful opportunities. This is the 21st century. Are we still in the 21st century? Yeah, I think so. Yeah, this is 21st century. Medicine is no longer streamlined as it used to be, like medicine and patient, your doctor and patient. There are other technologies and other things. So I just need you to open your mind. Do you get? Don't be too rigid on yourself. Don't be too closed-minded. Do you get? I don't think anything good comes out of being like that. Do you get? So yeah, so generally, yeah, I'm still trying to settle in. I'm still trying to make my place as conducive as possible. I just moved into my place here, and well, yeah, wish me luck, honestly. My next or my last week in pediatric surgery, I'm praying and hoping there don't be much emergencies. I'm hoping. I know this is weird. This is how the hospital, like this is what the hospital is meant for and all of that, but please don't fall sick. I beg you, mothers, please don't fall sick. And I feel one of the most common cases we've seen so far in pediatric surgery is intussusception. Do you get? There's this myth, I don't know if it's still a myth, that intussusception is caused by is common in children that are not exclusively breastfed. Most of the patients we've had, they come and they have started giving the child pap and other hard meals, say around 2 months, 3 months, and yeah, please don't do that. It's not advisable from what I have seen. Just stick to exclusive breastfeeding. Breast milk contains all the nutrients a child would need for healthy living, both water, protein, every nutrient a child would possibly need for growth. So don't jeopardize the child's health by giving the child what the child cannot be able to digest or absorb at that age. So I think that's that. Let me not bore you with too much medical jargons and all of that. But yeah, so something beautiful too happened. Apparently my girlfriends are doing their house job in this location as well. That's, it's always beautiful to have people or familiar faces around. It's actually very beautiful. At least once in a while when you're bored, you have familiar people to talk to, people that have known you from time immemorial. Not time immemorial, for the longest of time so far. So yeah, I think it's comforting in a way. Yeah, so I think that's that. I'm going to catch you guys in the next one. Yeah, hopefully I find enough strength to keep making these videos for you guys. I see your comments. Yeah, and your comments are another thing that keeps me going. I think that's that. Yeah. I'll catch you guys in the next one. Peace.